So, welcome to our presentation of Group D, in which we present our results for Assignment 3. And it's about health priority in Ghana, because we were consulted by Ghana's new government because they wish to redefine the priorities for public health policy. The budget for research and policy measures needs to be increased for the 3 diseases that are considered the country's main health problems, and this has to be counterbalanced by decreased spending on the other diseases. So the question we have now is which measures of disease burden are most relevant to decide on budget cuts or increases, and why? So we started with a short review of the literature, and we tried to come up with quality parameters for public health measures. And what we found were 4 important quality parameters. First is that the measure should be able to detect changes over time, either absolute changes or relative changes. But it should be able to show that there is a change in disease or in mortality. Second, the measure should be valid, meaning that the measure reflects objectively the health status or the change in health status. Furthermore, it should be sensitive to major health policy changes, so that we can measure the effects of policy changes. And fourth, and very important as well, is that the measure should be reliable. It should be stable over time and equivalent across different settings. So, besides these quality measures, we try to come up with 4 measures which we think are important for measuring the disease burden in the country. And we started with mortality, and then we thought of disease-specific mortality and leading causes of death, but also maternal mortality and infant mortality, because mortality really illustrates the contribution of specific diseases to the population mortality, and it allows us to select the diseases which have the highest mortality rates. Second, we thought morbidity was an important measure, and this can be reflected in incidence or prevalence numbers, for example, over the last 5 years. This measure shows the most common diseases and potential trends over time, like diseases that occur more commonly or diseases that occur less commonly. Next, we thought of quality of life measures like NHANES questionnaires, which can be asked per disease. And this shows a quantification of self-perceived health, which is of course also an important outcome because it's about how the population thinks or feels about their health. And lastly, we thought of some secondary aspects, such as access to care and use of healthcare, stratified per disease type, because this is an important surrogate for lack of well-being, and it might offer potential targets for improvements in healthcare. Also, we thought of costs spent per disease, because this is an estimate of the economic burden per disease, and it can be used as a basis for resource allocations, and that's exactly what we would like to do in this assignment. So what did we do then? We created a table with our 4 most important measures for health burden and the 4 quality parameters. And first we started assessing mortality according to these quality parameters. And we think that mortality can easily detect changes over time. It is valid, it's reliable because it's an objective measure. However, it might not directly show changes in government policy, since it might take some time before the mortality rates do change. And of course, it is dependent per type of disease. For example, policy measures for infant mortality might show direct changes, whereas policy changes for cardiovascular disease risk factors might not show direct changes. Next, morbidity. We think that morbidity does show changes over time. It is valid because it shows the true burden of disease, and it's sensitive to policy changes, but it might be a little less reliable compared to mortality because incidence and prevalence numbers can easily be underreported, or they can be miscategorized. Next, quality of life. We think quality of life is most importantly less reliable due to a variety of different questionnaires, which might also differ per population and per region. So it's not a truly reliable measure. It is valid, since quality of life is an important outcome. However, when persons are dead, you cannot measure quality of life anymore, so the validity is also a bit limited. Lastly, secondary aspects such as accessibility and costs can easily show changes over time, and they are valid as well, but they are also a little bit difficult to measure reliably. So based on our table, we would like to select the 3 most important health measures, and we then think that mortality, morbidity, and the secondary aspects are the most important measures for defining the top 3 health problems in Ghana. Well, thank you for your attention.